Around 7 weeks, I started noticing that he would not follow any objects in front of him. I saw that his eyes started shaking, so I decided to take him to his pediatrician, and he saw the shaking that I saw in the eyes, and he saw that he didn't follow. He recommended us to an ophthalmologist. The ophthalmologist confirmed that he had bilateral retinal detachments at 7 weeks old. He had his first surgery at 8 weeks old in Miami.
You know, I like sports. And all my kids, you know, they play sport, my older kids. So I was, you know, we're going to play sports. We're going to play football, baseball. When I find out, it broke my heart.
Sean was born on March 11th of 2010. He's 13 months old. And Sean was actually born with albinism, which is a inherited genetic condition which results in limited melanin pigment in the skin, hair, and the eyes. The major thing I think that we noticed was there just wasn't really an engagement, a lack of direct eye contact from a young age, and I think it was one thing right at birth, but as he started getting a little bit older, as we got closer to that 4-month time point when he was actually diagnosed, that's when we really noticed that something may not have been right.
Grace was born about 6 weeks early, and we knew that in utero, we knew that Grace had not fully developed hands or feet, and so when she was born, we expected that, but when she was 4 days old, we found out that she had underdeveloped and cystic kidneys and was actually in stage 4 renal failure. Her nephrologist told us that she had a 50-50 chance to live to her first birthday.
What you did to it?
Then at 6 weeks old, we had a visit with Dr. Blumenfeld and found out that Grace was very nearsighted, that in fact she had inherited my vision, which was the one thing we could have possibly expected, kind of the, you know, one more thing that was going on at her life then. And I think at 10 weeks old, we found out that she also had congenital nystagmus, which I have as well.
Good girl.
Kylie was born at 24 weeks gestation, so basically her due date was October 1st and she was born mid-June. She was 1.5 pounds when she was born, and she was a twin. Her twin survived 8 days, and then we lost her because her lungs just weren't strong enough. Kylie had her first surgery when she was 3 days old, and then when she was 7 days old, she had a brain bleed on her head. About halfway through her NICU stay, she developed what they call retinopathy of prematurity. Basically what that is the blood vessels around her retina formed abnormally, and if that happens, the retina can end up detaching and it can cause blindness. So she ended up having laser surgery for that and to resolve that.
Lighthouse's early intervention program serves children birth to 5 years old, and the only qualification is they have to have a severe vision impairment or blindness. One of the first ways that parents bond with their children is mommy holding the baby when they're being fed, or daddy giving the baby a bath, and that eye contact and all the silly noises that you make and the games that you play. And one of the first things that a lot of our families say to us is, I don't even know if my baby sees me.
In the NICU, we take care of sick babies. Some of them are premature, some of them have other problems that land them here. I'm one of a large group of neonatologists based here, and we take care of about 1,600 babies a year. We need somebody like Lighthouse who understands what the resources are, who understands the specific needs of their patients, and can move them along that path to really success.
As a parent, that's the whole crux of the issue, right, is the fear of the unknown. And so you get this diagnosis and you just don't really have any sense as to what this means in the long term. It's interesting, in just the year or so since he's been diagnosed, what a different perspective we have on it now. But we just weren't aware of any other children or adults as we become more included and more aware, the community of folks who live with low vision or blindness, I think we have so much more hope for Sean. But in the beginning, it was just a scary diagnosis because you didn't know what you didn't know. On paper, Lighthouse Early Intervention is here to work with Sean, right? And yet, I feel like I've benefited tremendously.
Well, I think that it's just great education for me too, to watch the things that Susan's doing with Grace, to see the games and just the little activities.
Thank you.
I truly believe that with Lighthouse, with them looking at the whole child, and they followed her cues. They didn't just come in with a plan and this is what we're going to do today and then that's it. Where some of our other therapists did that, and there was never a time when Kylie didn't enjoy having her therapist come to the house from Lighthouse.
It was really interesting because Susan was just watching. She had a toy, a ball for tracking, that Grace decided to start kicking. Susan said, well, okay, I kind of like the foot-eye coordination that I'm seeing, so we'll let her go ahead and continue that. And then I said, well, that actually ties in really well to a physical therapy thing that she needs to be doing, standing on one foot, shifting her weight over and kicking. So it's kind of neat to see how it can all incorporate together.
It's very critical to get these children at an early age, to get them hopefully within that first year of life, but if not within the first couple of years of life, to be able to have a year or 2 years or 3 years to work with them before they turn age 5. So much is determined before a child turns age 5, and it sets the groundwork for all future learning that comes after that. We are contracted with the Division of Blind Services to serve 64 children per year. We currently, at this point of the year, are serving 69, and I have another 7 children who have been referred who I haven't been able to assign to a caseload as yet. All of the sources of funding that we've had in the past have experienced cuts. Some of them are still there, but they're there in smaller amounts, and the cost of serving the children hasn't gone away. It's still there at the same rate or higher, and so it's just become extremely challenging to be able to find the dollars to serve the children.
If there was no Lighthouse in Central Florida, really our patients would be left wondering where they could go, and frankly, I'd have a hard time directing them.
There's a tremendous number of people that have visual loss, and maybe we didn't realize that until we had Sean and we found out about Sean's condition. But now that we're so much more educated and we've met a lot of other families, you really do, it's comforting to know that you're not alone. But also it's scary in that there's a tremendous amount of people that would be without support and services if funding didn't continue.
I know that Kylie would not be where she is today had it not been for our mentor, and I know that she has come so far because of this program, and I know that the mentors believe so highly in the program and in what they do.
Francisco is currently in a, very proud to say, kindergarten general ed classroom. He's no longer in an ESC program. The Lighthouse of Central Florida guided me to deal with the school systems and how to advocate for Francisco. And so nevertheless, in his kindergarten year, he's got all these resources and he's doing amazing. He's doing great.
The Lighthouse of Central Florida definitely saved Francisco's life.
Just in that 5-6 month period since we've been working with Lighthouse, I mean, just to see Sean's level of engagement and how much more dramatically engaged he is with us and other people around is really quite comforting, and it gives us a lot of excitement as far as where Sean will be in the future.
Man, what a great feeling that your child doesn't have to feel that they are unsuccessful or that they can't do anything, because Grace will face many challenges in her life. And I want her to always know that she can overcome anything she wants to, and that she will be able to achieve, and that there are services out there like Lighthouse of Central Florida that are going to help that happen.